Hello, hello. It is Kaylee Simmerman again. I'm super, super excited to have our next expert on. We actually have a doctor of chiropractic here with us. And so, Miss Madalyn, if you could just introduce yourself and tell us a little bit about what it is that you do.
Yeah, I'm Dr. Madalyn Turner, and I'm a chiropractor here in Tampa Bay. And so I'm a chiropractor, so I see patients for that. And if you're not familiar with chiropractic, let me just tell you kind of what we do, okay? So as a chiropractor, I focus on two things. I focus on your spine and your nervous system. Your spine has two functions. It keeps you upright, so it's your posture, and it protects your spinal cord. And I'm sure most of us out there know, but your brain controls every single thing in your body, right? Mm-hmm. So all those messages are going to start in your brain, they're going to travel down your spinal cord, and then nerves branch off of your spinal cord, and they go everywhere. So those messages are going to go from that spinal cord out those nerves to maybe a muscle, maybe a ligament, maybe an organ. And different stresses in life can take those bones in our spine and shift them out of alignment, and that can put pressure on those nerves that come out there. Mm-hmm. That's what we call a subluxation as a chiropractor, and that's what we check for and deal with as chiropractors. Nice. So An easy way, if you're not really sure what that all means, is have you ever kinked a garden hose?
Mm-hmm. Of course I have.
What happens to the water?
It stops.
Right, exactly. So if you think of that kink or misalignment, it's decreasing that water flow or that nerve flow going to where it's going.
Awesome. And I know you personally, of course, but if you could just tell our listeners a little bit. By the way, all of that sounds pretty familiar, right? So chiropractic and PT are pretty good working together. It's great to see kind of the differences in what your techniques are versus what mine are. But can you tell our listeners a little bit about the specific population that you treat?
Yeah, so I really love to treat my pregnant moms and postpartum moms. It's really great for them. So for pregnancy, I know a lot of times you might be getting low back pain or that sciatica. Maybe baby is not in the best position. It's really uncomfortable for you. And chiropractic is just a great option because if you are turning to medication, you can't really when you're pregnant, right? So it gives you a drug-free option. I would suggest if you are looking for chiropractic when you're pregnant, there is, and I can give Kaylee the information, but there is a website called ICPA. It's an organization, and that you can go on there and find Webster certified chiropractors, and you would want a Webster certified chiropractor, and it's a specific technique for pregnancy. Okay. It looks at your lower half, so that pelvic, so where your hips are, and that front half where the uterus is going to sit within that inlet. And you have muscles and you have ligaments within your uterus and things that are kind of hanging out in that area, which are changing as the pregnant mom's body's changing and baby's growing and baby's moving around. So that technique just focuses specifically on that area, making sure everything's moving the way it should be, which allows baby to have the best room possible, allowing baby to be in the best position possible as they're growing and preparing for birth.
Nice.
So we will see if moms are breech, they will typically find a chiropractor who is Webster technique, has that certification. And we're not flipping babies by any means at all. All we're doing is...
Thank you for clarifying that.
And definitely not. All we're doing is we're helping mom's body work so baby has the best opportunity and the most room possible to move the way they're supposed to in there.
Perfect.
Yes.
So that sounds like that would be something that would also assist or help a mother along into labor. Is that correct?
Yes. So it's just prepping them the best way possible. Usually it's helping cut down on labor time too, so you don't have to work as hard when you're there.
Sounds a little better.
Yeah, whether it's your first pregnancy or your second or so on. So it just helps speed up that process. It helps make it the best for mom as possible. Yeah. And who doesn't want that?
Yeah, absolutely. So with that being said, too, and just in your general expertise, do you send patients to pelvic floor PT?
Absolutely.
Yeah.
Yes.
And what is it that makes you want to send them to a pelvic PT? Because we've been talking, Buffy and I have been trying to introduce the idea of why it's important to have an assessment. And I think that it's important to note that a chiropractor doesn't do, or Madalyn specifically, doesn't do exactly what it is that we do. So when is it that you send to a PT? Because I send to you for more alignment, adjustment, things like that.
So I definitely, if I know a woman is planning to get pregnant, if they're pregnant or postpartum, I always recommend they visit a pelvic floor PT just to get examined and checked out and know where they are. Especially postpartum if they're having symptoms that are going on that I don't particularly help with.
Absolutely.
And then I still will consider like a pelvic floor PT for a referral if I have a woman in there who, if I know they're having issues with, they're working out and they're peeing their pants. Just like constant low back pain that I'm not getting any they're not responding as well as they should. And I can tell just based off of doing different tests that maybe there's some core and pelvic floor dysfunction there that's without my scope of practice.
Yeah.
Right. I don't do the same exams you do. I can't do that internal work. So, and I'm not only am I, it's out of my scope of practice, but I'm not skilled in it, so I'm not going to be good at it. So I'm definitely going to refer to somebody who knows what they're doing.
That's good. Awesome. And that's awesome to note too, because it's a good thing for you guys out there listening to understand that we do work together for your benefit. We do try to make sure that we get you the best option, because it's the same with me. If I'm treating and I'm doing internal work and fascial work and mobilizations and movements and all of these good things, or movement or alignment type things, and I'm not getting any benefit, then I'm going to refer to somebody else or another professional that may be more skilled at that than I am. So,
absolutely.
Yeah, I think it's important to get that teamwork. And we talked last couple of podcasts about the importance of connection and having people around that are there to help you. Make sure that you build your healthcare team, and don't, we're all a little bit biased, of course, in our expertises, but make sure that you're finding someone that's willing to find the best care for you.
I think that is so true, and I've had so many conversations with this about patients, especially I find women definitely, like, no, it's your health, and it's your health care. You have every right to walk in and ask questions and to know about your body and to get answers from your doctor, and if you're not feeling comfortable in that, or your doctor's not giving you don't feel like they're giving you options, then ask around, because there's always a different option. You should be being heard, and your doctor should be working with you, which is, I think, one of the things that we pride ourselves on is exactly, like, I know, like, my outcome is to help that patient on what their goals are and to help them heal and to get better. And if I can't do that solely myself, or I'm not helping them, then I'm absolutely going to use my team of other people I know to co-manage with them and get them the help they need, because it's about the patient. It's not about me.
It's not about us at all. Absolutely. So can you go into a little bit more about what are some common patterns that you see in your female patients that you treat?
I see, I think, more in the female population, a lot of headaches, migraines, and then a lot of maybe popping, clicking, or issues with their jaws.
Yep, absolutely. Do you see low back pain a lot in your pregnancy?
Yes,
during pregnancy. Not in yours.
Yeah. I haven't been pregnant yet. Yes, definitely too. Definitely during pregnancy, a lot of low back pain, or that sciatica, where that pain starts in that back and will travel to, like, your butt or down your leg.
Yep. Because for me specifically, I see a lot of core dysfunction or pelvic pain during intercourse, or prolapse symptoms as far as, like, a lot of abdominal pressure. So knowing, that I don't see as much of the headaches, but I guess I do see more headaches in female population than males. That's kind of cool, though. So for our listeners out there, knowing, you're listening and you're like, oh my gosh, that's me. I'm experiencing all of those things. What is something that they can do now to kind of combat that? What is an action step that they can take now?
Yep. So typically, of course, I always recommend chiropractic. So I would look for a chiropractor who can help you with those things. And if you need help asking the right questions, they can help you with that. So definitely that, because remember we talked about that nervous system and those nerves coming out, and those nerves that come out from your neck are directly feeding into that head and face and that jaw area. So if there's a misalignment in that neck, it can be influencing those headaches and those migraines or the jaw there. Also, too, just some other things that you could start doing right now are some just different postural exercises. Yeah, so a lot of us, we look at posture. So a lot of us, our ears are actually in front of our shoulders if you look in the mirror. And they should actually be over top.
Yeah, absolutely.
So you can just work on, we call it, like, kind of making a double chin, on bringing that chin back, trying to keep that, not tipping your chin down towards your chest, but bringing your head straight back. And that's going to work on re-educating those muscles in that area, which can help give some relief. Too.
Absolutely. I would have to say also posture in the physical therapy realm of things. We were, it's important to note that you're sitting appropriately, which I'm not right now. I just corrected it. That you're sitting correctly holding the baby, that you're sitting or laying, nursing correctly. Making sure that all of those postures are best for you and your body is very important. So that's a similar thing that I would say as well, and I think that that's important. And
minimizing time on devices. So a lot of texting or computer work, and a lot of us are doing those type of activities at work. We're on the computer all day. Then we're going home and we're spending time on our computer or on our cell phone. So that repetitive looking down motion puts a lot of stress on those nerves and those muscles in that area.
Yeah, so absolutely paying attention to those little tidbits or those tips that she's given already, doing that, then seeing, your pelvic floor PT and also your chiropractor and making a whole team about it is going to be the best thing for you and benefit you the most. So, Madalyn, when do you feel is a good time for a woman to see you specifically? Like, do you think that it's only when they're having pain?
No, absolutely not. Pain, you can have issues going on and you don't have to have pain. Mm-hmm. Pain is typically one of the last symptoms to show up and one of the first to leave when you start getting treated for something. So I always recommend now, like today is a great day. If you've never been evaluated, then today is a great day to check it out and get seen, because again, you can't just wait for that pain. If we know pain's there, you've usually lost about 80% function by then.
Yeah.
So it's been there for a while. It's your check engine light. It's finally coming on for your body, telling you, screaming at you to do something. Yeah. And I like to educate my patients to do more of a preventative approach. Yeah. So making those choices that's going to build health in your body, not waiting for something to happen to you for that pain, so you don't have to deal with your health in a reactive state.
Yeah, absolutely. And it's important that you say that, because in physical therapy, it's very similar. I recommend that all women see a pelvic PT at some point.
Yeah.
You need to see a pelvic PT or need to try to see a pelvic PT before getting pregnant, so during the prenatal phase, during pregnancy, after pregnancy. Because what the pelvic PT can do is that internal assessment to make sure everything in that bowl area, or the part between your legs, really, that is working appropriately with your breathing patterns and with your core. And then with chiropractic, you're able to make sure that the alignment and stabilization and everything is all working together. Can you imagine how amazing our bodies would feel?
They would be fantastic.
Wouldn't that be great? So can you talk a little bit about what a patient can expect from seeing, and I think that you had said specifically Webster technique?
Yep, if they're pregnant. Yep.
Yeah, what can someone expect just from seeing a chiropractor?
Right, so we all do practice a little bit differently, so your experience can definitely change from whatever office you're into, but generally you're going to walk in, they should be doing an exam and sitting down and doing a consultation with you, so talking about where you're at today, what are you coming in for, what's your past history like, what maybe traumas have you had in your past or surgeries that could be influencing what's happening today. Again, what are your goals? So how is this influencing and impacting your life? What would it be different if you didn't have to deal with this like it is right now? And then, like I said, every chiropractor is differently. So maybe if x-rays are warranted, they might recommend x-rays and check those out and look at your alignment of your spine that way. Or just do some other exam, maybe a postural exam, some different orthopedic tests, just to get as much information as possible. That way they can treat you safely.
Yeah, absolutely. That's awesome. Awesome. And what advice would you give to our listeners right now, as far as, because I know a lot of people know that or think that chiropractors just pop bones or put you back in place.
Sure.
So what advice or recommendation would you give to them to kind of consider anything like that?
Yeah, I hear that quite often. I hear, I'm scared you're going to hurt me, or I saw that YouTube video one time, or I saw that movie, and all those things. One, movies are fake, right? Like we watch TV and we don't even reality TV is not reality. So,
I know.
Yeah, I did go to school. It wasn't a weekend course. There was boards. There's things I had to do.
Yep.
So just reassure and know that those testing, and when we do sit down and do that exam with you, it is to rule out different things. We're looking for certain things. If there may be a certain adjustment's not warranted for you specifically, we have all kinds of different techniques. So if one thing doesn't work for you, we have another thing we can do that can replace it. You can still get great results with it. So just reassurance with that, and have a conversation with your doctor. They, again, like we talked about earlier, they should be able to respect where you're at. And I know a lot of patients I've had have never been to a chiropractor before, so there is that fear factor. It's the fear of the unknown. They're not really sure what to expect. So I take time to explain that to them, to reassure them as I'm taking them through that first adjustment on what they can expect, what the outcomes can be. And you can be sore. You could feel worse after your first adjustment. That's completely normal, because everyone heals differently.
Absolutely.
So to give them recommendations afterwards for that to help calm down that inflammation. And I don't know. That's about it.
Yeah, absolutely. I think that's important to know that she has training.
Yes.
Chiropractors do go through a doctorate program. Physical therapists who are pelvic PTs go through a doctorate program. We get that doctorate degree, and then we continue our education.
So we have to continue too, and to keep that.
But the most important thing I think that you just said was just a reminder they need to respect where you're at.